our Across the Aisle segment tonight. If there's one political statement that should scare you more than any other, it's this one. Healthcare is a right. That's the talking point Bernie Sanders has taken up recently in his effort to pass single-payer healthcare. But here's the scary part. To people like Bernie Sanders, it's not really about healthcare. It's about increasing government control over your life, and single-payer is just a good excuse to do it. This is Bernie.
We talk about morality. What we are talking about is all of God's children, the poor, the wretched. They have a right to go to a doctor when they are sick.
Whether you're a mother battling cancer or a grandparent in a nursing home or a kid with a cough, you ought to have access to health care.
For those people who do not have access to health care, where is the justice?
With Medicare for All as our goal, we will be able to ensure that Americans are having access to the health care that they need from the day they are born and for the rest of their lives.
With me now, professor and author of Obama's America, A Transformative Vision of Our National Identity, Ian Reifowitz. Ian, good to see you, friend.
Good to be back, Liz.
All right, Ian, I don't have to tell you that I don't like the idea of government being in charge of my medical care, my health care, or anything to do with anything health related. But I want to start this segment by showing a tweet from Senator Kamala Harris. This is what it says. She says, when it comes to health care, prevention first is key. If we're dealing with sick Americans in the emergency room, it's too late and it's too expensive. Ian, I agree with that. I do. I agree with that when it comes to individuals making individual choices about their life. But my question to you, if government is in charge of our health care and their goal is prevention, to prevent people from having to go to the emergency room, where does that end? When does it become government's role telling us what activities or what food we have to abstain from, what sort of exercise or medication we have to take to prevent them having to pay for our healthcare costs in the long run?
Well, you know, the slippery slope argument can be used to shoot down any idea. I think we have to take things as they are. If you're talking about an expansive government role in healthcare, if you're talking about some kind of single payer, national healthcare, socialized medicine, to me the best evidence in favor of it is the fact that no country in the world that has ever gone to national healthcare or socialized medicine or single payer has ever gone back away from it. If it was such a nightmare, these countries that tried it would then give it up and go back to some kind of more privatized system. We don't see that. I want to give you the name of a country. It's called Cuba. The United States, with its private healthcare system right now, has a worse infant mortality rate and a worse child mortality rate than Cuba. That's Cuba, and I think you know what kind of government system they have there, Liz. It's not one that I like, and it's not one that you like either. The U.S. has the worst maternal health rate in the developed world. We need more government involvement in healthcare, not less.
All right, Cuba. I can't believe you brought up Cuba as a healthcare system that we should follow here. But let me ask you this. How does Cuba, what elements does Cuba use to define their infant mortality rates? And then what elements does the United States use to define our infant mortality rates? Are they the same?
Yes, they are. It's a pretty simple one. It's how many people there are born and then how many of them die by, within, I think it's the first year for infant mortality rate, and under 5 is under 5. So these are right, but no, they don't.
And they don't use the same thing. I've heard this argument before. They actually do not, because they don't consider a lot of other countries that have government-run health care or that don't respect the dignity of life the way the United States does. They don't have the same life-saving techniques that they use for infants. They don't count stillborns as being a baby that's born, whereas in the United States we do. They don't try to save babies who were born, at 23, 24, 25, up to 30 weeks. They don't try to save them if there's something wrong with them. They don't actually count unborn babies who become born babies and die shortly thereafter. They don't count that in their infant mortality rates. If you use the same elements, if we use in the United States the same elements that some of these other countries do, we have a better infant mortality rate than they do. So I don't think that's quite a fair argument.
I'm sorry, Liz, but that's just not true. First of all, these are statistics that are easily verified and easily verifiable. These are statistics that are quoted across the board. There is no backtracking from the fact that we have a worse infant mortality rate than Cuba. We just do. And
right, that's what I'm saying. But it's not the same. It's not the same formula that we're using when a baby is born. No, it isn't. No, it isn't. Just like you said, it's easily verifiable. Look it up yourself. I encourage our viewers to go look it up.
I have.
Yes, we try to save babies' lives when they're born and they have a serious medical problem. Other countries don't do that the same way. I mean, there's even arguments within our country, within our own country here, about when we should try to save babies and when we wouldn't. We all remember from the 2008 presidential campaign when President Obama, it was then Senator Obama, when it came to light that he had argued against giving medical care to babies born alive after botched abortions. Do you think in Cuba that they give those babies life-saving care? Of course not. And they don't count those babies when they die as having died, being a baby who dies. They count that as just a pregnancy that ended. Look up the facts. It's not the same at all.
I encourage your listeners to do the same thing, your viewers to do the same thing. These are alternative facts you're presenting here. Okay, I'm sorry. We can't debate the facts. The facts are that we measure the same way that they do, and our rate and maternal mortality is the worst in the developed world. Do you really think that there was some way to go from worst to first? So the point is that we need a government role in healthcare, and if we didn't need it, we wouldn't see all these other countries embracing it and pushing for it. Preventative care, as Senator Harris talked about, is really important because that's how you control costs. That's what's so important. When going to the doctor becomes difficult because of cost, when getting insurance becomes difficult because of cost, you don't have people getting preventative care. Then they show up in the emergency room and we have to cover them. If we could have more government spending on community health clinics, on coordinators, on other things, other individuals who can work on improving people's health before they get sick, before they need to go to the emergency room. That's another way of controlling costs. You can control costs by getting the CEOs out of there.
Right, but you're missing the point. You're missing the point that I made at the beginning of the segment. I'm not against preventative care. I think we all participate in some measure of preventative health care so that we don't get sick. But my question is, when it doesn't become just our responsibility to do that, your choice or my choice to take vitamins or exercise or eat healthy or take medications to prevent whatever chronic illnesses we all have from getting worse, when it moves from the hands of the individual into the government, when does government become dictatorial about it? When do they say, listen, broccoli's healthy for you, you must eat broccoli every day or else we're not going to pay for whatever illness you have? When are they going to say, listen, we don't think it's healthy for you to engage in running a marathon. You are not allowed to do that if you want medical care. Or conversely, listen, you're too fat. You must run a marathon or you don't qualify for health care. That's the point I was trying to make. But I would like to end the segment just with a thought experiment in a sense, and that is to ask, if Cuba is really as good of healthcare system as you say it is, why does nobody leave America to go to Cuba? And why do people from Cuba swim through shark-infested waters to try to get to the United States if their healthcare system is so great and gives them everything they need?
I'm talking about specific instances, specific statistics in which our system is not as good as their system. I would never want to live in Cuba. I'd much rather live in the United States. It's a free country. And if anybody tries to tell me that I have to eat broccoli or run a marathon, Liz, I'll expect you to stand side by side with me in rejecting any such mandate. What we're talking about is creating a system of health care in which the government protects consumers and makes sure that those who can't afford access to care get it through some kind of funding scheme, whether it's Medicare for all, as Bernie Sanders want, or some kind of Obamacare system, which, as we can see by comparing it to Medicare for all, is one that utilizes
funding scheme is exactly what that is. It's exactly what it is, and it wouldn't work. We're going to have to continue this next week because they're telling me that we are out of time here. But Ian, I always appreciate these debates. Thanks for being here.